Hello, I'm Julie Cox-Sid. I'm the coordinator for Cox Technic, educational seminars, the website, practice support materials for patients and doctors, communication for the Cox 7 table manufacturer, Haven Innovation, and content director for the Cox Technic Complete program. It's a pleasure for me to work with doctors, both certified and non-certified in Cox Technic, patients, researchers, and all those involved with the technique. The information online about Cox Technic, or Flexion distraction as it was first coined by Dr. Cox in the 1960s, has grown. We would like to contribute to this information with some official demonstration of Cox Technic, its protocols, goals, and research. Here is Dr. James Cox.
This is what Cox Technic looks like. Hello, I am Dr. James Cox, developer of Cox Technic Flexion distraction and decompression spinal manipulation. Note that Cox Technic is gentle, it's smooth, it's rhythmical, it's doctor-controlled and specific level applied to the patient's spine. Whether treating the low back as I've been doing here, or treating a cervical disc herniation in the cervical spine, the treatment is always the same. It is smooth, rhythmical, slow, and specifically applied. In the years since I introduced and first called this technique Flexion distraction, Cox Technic has grown in the science, acceptance, and effectiveness. I proudly share it with my chiropractic colleagues, of whom 64% report that they use Cox Flexion distraction in their clinical practice. In light of this proclaimed usage, I strive to establish Cox Technic responsibly with research, education, and documentation. With the National University of Health Sciences, the Cox Technic certification course offers training in the proper application of this technique, and nearly 2,000 chiropractors have taken advantage of this certification opportunity. I am humbled by each certified Cox Technic doctor's dedication to caring for spinal pain patients in a classic chiropractic way using their hands. The certified Cox Technic doctor uses his or her trained, experienced tissue tension senses to monitor this adjusting procedure at all times. The certified doctor knows the importance of careful tolerance testing throughout the application of this treatment. Yes, it looks easy. I hear that all the time, but it is the balance of the hand pressure and the table motion that requires skill and experience to optimize patient clinical outcomes. The certification course we mentioned ensures that the certified doctor experiences the proper force application. Further, Cox certified technique doctors know Protocol 1 and Protocol 2, which are the divisions of types of patients with back, arm, and leg pain which we treat. Certified Cox Technic doctors fear not the worst spinal conditions, such as spinal stenosis with a disc herniation, or post-surgical continued back pain, or the simpler, yet no less painful degenerative disc, sprain and strain, or facet arthritis. Certified Cox doctors practice in the knowledge that there are documented clinical outcome studies which detail the number of days and the number of visits required to attain maximum relief for their patients. That there are also clinical guidelines that lead the doctor to gauge patient response and to know if that response is expected and adequate to meet the patient and the doctor's clinical expectations. There are federally funded research studies that show the millimeters of pressure that Cox Technic drops inside of your intervertebral disc as we apply technique as you see here. Again, in treating the thoracic spine, You'll note that again, the doctor's contact is specific. It's gentle. It's a smooth movement of decompression with the bottom section of the table. It is very specifically applied to the given level of the spine that is creating the patient's pain.
I invite you to visit these websites for more information on the Cox Technique, its certification course, research and referral directory of certified doctors, the Cox Table by Haven Innovation, the preferred instrument for Cox Technique spinal manipulation, and Cox Technique Complete, the clinical practice program for flexion distraction practitioners' use to tell their communities that they are the spinal pain relief specialist to see. Thank you for your interest in Cox Technique.